My mother is going to be 95. She was always a very social person, but 2 years ago, it started to change. I started her 2 days a week, and even on weekends when there's no center, she gets up and gets dressed, and she wants to know why she can't come. So for her, if there were 7 days, it would be beautiful for her. Now I have this block of time that I can do errands. I've gone back to yoga, and I can meet my friends for lunch or, do things that I couldn't do before.
Originally, what started out to be a bit of an additional rehab for me to get out, it's been incredible. My life is so much richer because of being able to come here every day and interact with the other participants and the staff as well.
The impact on me is many-focused. It does allow me to work. I actually do work part-time, which is a huge benefit for me. It allows me to do errands, doctor's appointments. It allows Len and I some space. To have the opportunity of having some space, which is also productive space, it's a really important thing emotionally for caregivers and for family members. When he's not here, he misses it. He has to call in to make sure that they're doing everything just the way they always do it. If we go on vacation, he still calls and checks.
I call from the beach.
Yes.
Hello, I'm Ann Hall. Welcome to Mature Living, a program that features topics of interest for older adults. While a longer life is a wonderful gift, the growth of the older old population creates new challenges to families and communities who want to ensure their care. This is because the older old population is far more likely to have conditions that impair their capacity to care for themselves. Today, we will be discussing one response to this challenge: community-based adult day service centers. While each center is unique, they are broadly defined as providing therapeutic, social, and health services. Representatives from 3 local centers are here to discuss the important benefits they provide participants as well as family caregivers. Joining me for the first session are Jennifer Robinson, the manager of the county's Adult Day Health Care Center programs, and Noelle Andriano, Development Associate with Insight Memory Care Center in Fairfax. Welcome to you both.
Thank you.
Jennifer, we'll begin with you. I understand that the county's Adult Day Health Care Centers are run by the county's health department. Could you tell us about these centers and where they're located and the kinds of services that you provide?
Yes, and thank you for having me. The health department operates 4 adult day health care centers throughout the county, 2 in Alexandria, 1 in McLean called Lewinsville, and 1 in Herndon. And the services that we provide are for those people who are perhaps living with their adult children who have cognitive and or physical impairments and can't be left alone without supervision. And so they can come to us Monday through Friday, 7 to 5:30. They can get transportation to come, pick them up and bring them into the center. And it's for people who are generally in their 70s and 80s. However, we do take people who are 18 and over with disabilities, but most of our population is 70s to 80s with cognitive and or, as I said, physical. So there's a lot of them with dementia. And we provide activities. We have nurses to do healthcare monitoring. It's a very highly qualified staff. Program assistants who can help with incontinence care or ambulation. People who come could be in a wheelchair, use walker, cane. I mean, we see all levels of functioning and as well as cognitive functioning.
So how many people are in these centers, and what's what type of people participate? You mentioned some of the needs of the people.
Yeah, so because we are serving mostly elderly, you're going to see a lot of people, as I said, with dementia, but also with chronic illness. Generally, the centers have 30 to 40 available slots, and there's space in all of them. So go to the website and see if you need to go to one of them. And they have chronic illness. So we take care of people with diabetes, Parkinson's, chronic obstructive pulmonary disease, all the liver, lung diseases. So we have nurses there. And one of the best parts, besides the activity program, is that they catch things early. So we can catch early symptoms of a disease or some illness that might be progressing, and we can keep people out of hospitals, which is really important for the elderly.
Right, that's great. So can you walk us through a typical day, starting with how participants go to the center?
Yeah, as I said, we have transportation. Some people are driven by their family members, but transportation can be provided by Fast Tran. They pick them up at the door at their home and bring them through our doors, and then they're greeted with staff, a big smile, and welcomed, and they get going on their day, whether they choose, it's really what they choose. They might choose a jigsaw puzzle or have coffee with a friend or breakfast. And then they get into the exercise program, which leads into numerous activities. And it's really based on what they're able to do, and we want to make them feel successful. So, you know, it could be arts and crafts, it could be an adaptive sport like balloon volleyball, it could be, we go on field trips, we go to, whether it's the restaurant, we went to the White House one day for the Christmas tree display. So they're very active, and there's music therapy, pet therapy, art therapy. It's just a packed day.
That sounds amazing.
They get lunch and snack as well, and
meals too. That's great. Well, what do you consider to be, in general, the most significant benefit of care?
I would say it's twofold, really. It's one is for the participants. So we do a survey every year, and we have a very high satisfaction rate, almost 100%. But the reason is because when they come to our programs, the family members say, well, now they sleep better, their mood is improved, they're more engaged in life, they have better physical health. So it's just a better holistic sense of themselves. And then for the caregivers, it's tremendously beneficial because caregiving is, as so many of us know, very stressful. You got to keep the caregiver healthy. So,
especially if the caregiver works.
Yes, exactly.
Yeah.
They know that they can go to work and feel that their family members in a safe, nurturing environment.
Very good, thank you. Noelle, we haven't forgotten about you. I understand that your center is a nonprofit and it receives some of its funding from the county. Could you give us some background on how the center began?
Yes, much as Jennifer was saying, our founder discovered that there was a need in the community for family members who had loved ones with Alzheimer's or other dementias, that they needed a respite during the day. They needed somewhere that their loved one could go during the daytime so that they could either go to work or run errands or anything like that. So we were begun as a nonprofit in the basement of a church, which was 3 participants, but eventually became a licensed adult daycare center, the first and still the only dementia-specific day center in the Northern Virginia area. We also eventually added late-stage programming, so we can take care of anyone from moderate to late-stage dementia. And then that's in our day center, but then eventually added early stage programming as well. So anyone who's not quite ready for the day center, we have programs for them. We've gone through a couple location changes, as well as a few name changes. Since since 2014, we've been Insight Memory Care Center to better show everybody that we can take care of anyone with any memory impairment, not just Alzheimer's. And we've been in our current location for about 1.5 years now. It's specially designed for people with dementia and other memory impairments. We have now also the day center side and then a separate annex where we run our support groups and education programs so that we can, again, take care of the whole family, not just the participant, but the caregiver as well.
Right, it sounds very comprehensive. So could you walk us through a typical day, and how do your participants arrive?
Absolutely, it's much the same. Many of them are brought by caregivers. We also work with Fast Tran. If they do live outside of Fairfax County, they can also take advantage of Metro Access, which works much the same way, hand to hand, picking up at the home, bringing to the day center where they're greeted by our caregivers. We're open from 7:30 to 5:30, Monday through Friday. They can come anytime during that time, whatever works with their schedule. They have breakfast, lunch, and 2 snacks, and then a day filled with activities. Our activities are very person-centered and individualized to our participants, so there are a number of activities going on at any one time in the day center. They range from art therapy, pet therapy, a lot of focus on music programs, whether that being performers or our music and memory program, which individualizes playlists to individuals with dementia, which has been found to be very helpful in just stimulating them.
Right, right. Well, here's a question for both of you. I'm guessing that the answer might be a little complicated, but how much do your programs cost, and how do people pay for them? In other words, will insurance cover this, or Medicaid, Medicare?
Medicaid, the elderly and disabled waiver will cover it if the person qualifies for that. We take long-term care insurance as well. But most of the people pay, it's private pay, but it's based on their income, meaning it's the participant's income, and if they're married, the spouse's income. If they're living with their adult children, we don't look at their income at all, and the fees range from $16 a day up to $109 a day, which, when you consider most of our clientele would qualify for nursing home level of care, it's a very affordable care option.
And is that the same for your programs?
We are private pay, and it's based on the level of care. So we do take from moderate to late stage, and also dependent on days of the week. We offer a minimum of 2 days a week up to 5 days a week. And depending on level of care, that can range from, for our moderate level, 2 days a week is around $1,100, up to around $2,400 for 5 days a week. Now that would go up for later stage because they do need more direct care, feeding, and things like that. But all of our fees can be found on the website, and we also do work with long-term care insurance to help be reimbursed. And these are monthly fees, so we will work monthly with long-term care insurance. And we have a scholarship program for anyone who can't afford our fees. They fill out an application, and our board will review their application. It is based on their income level and assets and things like that. But we never want to turn anyone away, so there are ways that we can help someone who might not be able to afford our fees.
I see, thank you. One thing I wanted to follow up on, you mentioned the caregiver groups. Could you tell us about these and who leads them and where they're located?
Yes, most of our caregiver groups are located at Insight Memory Care Center, but we also offer them throughout the community. They are all free and open to anyone in the community. You do not have to be a part of Insight to attend. Most of our support groups are broad, and just anyone who has a loved one or friend that has dementia or another memory impairment can come, have that social aspect, but also talk through their experiences with our Director of Education and Support Services leads most of them, but others of our trained staff will help lead the discussion, but it's very open to the family members who come just to kind of talk about what they're going through, but also receive some caregiver feedback, which also includes our classes where we do teach them about what they can expect as a caregiver and give them some other tips as well as other resources in the community that they could use.
That's very helpful. So what's the best way for people to find out about both of your programs?
Definitely going to our website, which I know will be shown at the end of the program. You can also find our phone number on the website. Anyone can feel free to give us a call, set up a tour, or come by every second Tuesday of the month. We also have just a brief overview and tour that's just set up each month that anyone can feel free to drop by just to learn a little more.
Okay.
I would say it's the same for us, the website, and has all the lists of all the centers, but they can also call me directly at Jennifer Robinson, 703-246-8743, and I can give information as well.
That's excellent. Jennifer, Noel, thank you so much for being with us today and sharing all this important information.
Thank you.
Thank you
for having us.
Coming up, we'll learn about a somewhat different type of program. It's called a Program for All-Inclusive Care for the Elderly, or PACE. and it's run by Enova Cares for Seniors. We'll be right back.
I do the morning stretch exercise, which means we do exercise every day in the morning. I like what I'm doing most. And I love help people naturally, you know, so the goodness I offer to the people, you know, and they tell me thanks every day, and they just say, oh, without you I can't do this, thanks every day, and I just look at it like it's a blessing, you know.
I had my career as an engineer, and that made me very observant, so I enjoy observing people and how they interact with each other and how they interact with me, and I find it a very pleasant experience. It also gives me help with my therapy, and it gives me an opportunity to interface with people and enjoy their company, and I certainly hope they enjoy mine, but they at least laugh at my jokes.
Well, it's a place to come, and I've met a lot of new friends and made a lot of new friends, and just I would miss it if I didn't have it to come here.
I actually came here because I was in a horrific car accident and did not wear my seatbelt. When I first had arrived, I was in a wheelchair, I could not walk, and I had just become weight-bearing the month before. And they personalized the physical therapy to what my needs were. I attribute my being able to walk right now to PACE.
And I used to walk with a cane until about 3 years ago. And then I started falling. And that's when my sister got me in this wheelchair. So I'm determined. I told her before I leave PACE, I'm gonna be walking. My PACE benefits me. It wants me to keep trying, don't give up.
In the first part of today's show, we discussed 2 adult day health care programs in the county. In this segment, we will discuss a similar program that has at least one important difference. It offers comprehensive health care services to participants on site. Joining me for this part of our discussion is Dr. Marwa El-Menshawi, Medical Director for Enova Cares for Seniors, PACE. Welcome. Thank you for joining us today.
My pleasure.
I know that PACE stands for a Program for All-Inclusive Care for the Elderly, right? Can you tell us what it is and about the history of its development? I understand that the first one began in San Francisco, is that right, in the 1970s?
Yeah, that's absolutely correct. And so PACE is a model of care program really designed to be all-inclusive. So, you know, we handle everything for our participants, from their home care needs to their medical care needs, their social needs as well. It did start in the 1970s in San Francisco, Chinatown. A public health doctor, his name was Dr. G, was looking at a way to provide care for the elderly population there. And in fact, initially they were looking at a nursing home because the population had a lot of medical care needs that were unmet, social needs that were unmet. They needed to have somebody take care of them during the day, and their children, who were their primary caregivers, were working. And when they explored that option of a nursing home, they realized that that was really not a good option at all. And that in order for those patients to thrive, we really needed to figure out a way to keep them in the community. And, you know, around a vibrant family and social life, but at the same time make sure that they're safe during the daytime and they have the medical care that they need. So
interesting.
Eventually, you know, the modern day PACE slowly developed.
Very interesting. So where is the Enova PACE located, and when did it open its doors?
We opened our doors in May of 2012, so a little over 4 years ago, and it's located in Fairfax County.
Can you describe the people that you serve?
Absolutely. We serve really a wide variety of people. 55 to I think 102 was our oldest participant. And this population really needs help on a daily basis. So they have chronic medical conditions. I think our most common diagnoses are diabetes with the complications that diabetes carries, vascular disease, heart failure, emphysema, and a significant portion of our population also has some form of dementia or other neurological diseases like Parkinson's or multiple sclerosis.
How would you describe the program's mission?
Our mission really is for our patients to age gracefully in their homes, in the community, to figure out a way to address the unique needs of every patient, both their physical needs, medical health care needs, as well as their social and emotional and spiritual needs, in order to really enable them to spend their life in a dignified, engaged, active fashion.
That's lovely. So could you tell us a little bit more about the services that you offer and how your program differs from the adult day health care center?
Yeah, so the Adult Day Health Center is a big part of what we do, but we are all inclusive. So we start off looking at our patients' homes. We have a team of practitioners that include physical therapists, occupational therapists, of course the clinical team, the doctor, the nurse, as well as a home health nurse. We have social workers, dietitian, transportation. So everybody meets and assesses our patients really full spectrum. So we look at their home, we make sure that their home is safe to live in, that they're not going to fall, for example, because a throw rug is placed where it could be a potential hazard. Right. We look at their bathrooms. Do they have grab bars that will also help them not fall and make it easier for them to transfer? We look at the lighting in their home to make sure that there's adequate lighting to prevent falls, because we know that if a person falls and breaks a hip, they have significantly increased morbidity and mortality, something like a 6-month life expectancy in a lot of cases. So if we can prevent these things starting at the home, we really can have a significant impact on someone's quality of life and life expectancy in general. We also address transportation, which is a big barrier for a lot of patients in order for them to get the care they need. So we have a set of drivers. They really know our patients very well. They know what equipment they need. They know that they need a cane or they need a walker. They know what they look like on a daily basis, and so they're able to tell us early on if they notice something is off. Right. We also send home health aides to help the patients that need help, for example, getting ready in the morning because their family member is at work or is dropping off the kids at school, or maybe they don't have somebody available to them. They live alone. So we send somebody in to make sure that their care needs are met. They're fed and well dressed, and
Sure.
Their hygiene is taken care of. And then we bring them to the center where we have the Adult Day Health Center activities. So we have a recreational therapist. We have lots of other activities like Tai Chi, for example.
So could you walk us through the typical day once they arrive? What
Absolutely.
happens?
So once they arrive, generally depending on the time they arrive, if they're early enough, they come and have breakfast, kind of socialize with their friends at the center. And then there's usually a full schedule set up for the participants. So they do current events, they do exercises. We have musicians come over and perform for the patients. They have wellness groups, so they partake in activities that involve therapy as well. And on site, we actually have a full active medical clinic. So our patients are also, if there's anything wrong, they're brought to the clinic where they can be seen by, a doctor or nurse practitioner. Immediately. And we think that that's, catching things early really, prevents potential hospitalizations and significant illnesses. We manage their preventive health, so we make sure that they have all their vaccines. We make sure that, if they need a mammogram or if they need a DEXA scan to check on their bone density, that's taken care of as well. And we follow their chronic diseases, so we're making sure their blood sugars are checked by the nursing staff every day that they're at the center. We help them get their medication, so their insulin is given to them. And if there's an emergency like a fall or chest pain, we actually have the capabilities to do urgent care type treatments there. So yeah, we can do an EKG on site, we could do IV fluids, send them for an X-ray, really following our patients throughout the healthcare settings that they go to.
This is wonderful. So it sounds like this is so comprehensive. Is there evidence that participants in a PACE program actually stay healthier, or that they're more engaged from the program?
Yeah, you know, we found out that when we're keeping a really close eye on our patients' medications, making sure that they're not taking something that expired a couple of years ago or that one of their other doctors discontinued, when we're also keeping a close eye on their nutritional status, so our dietitian is making sure that, you know, they're getting enough protein and they're getting enough carbohydrates and or not taking too many carbohydrates. When we are in the home and making sure that their environment is safe and that they have the equipment that they need to help prevent falls. Patients do have overall better quality of life and less morbidity and mortality. You know, they also feel more empowered to take care of themselves and to be a partner in their health care.
Interesting. So how much does the program cost, and does insurance cover any of the fees?
Yeah, there's a partnership between Medicare, Medicaid, and Inova to act as an insurance company for the patients. So some patients, depending on their resources and income, may not have a copay at all. And other patients have a monthly copay, and that could vary from, you know, less than $100 all the way up to several $1,000s if they are private pay.
Right.
So if they don't have, you know,
long-term insurance.
Well, yeah, or Medicare or Medicaid. And overall, you know, this fee, this one-time monthly fee, covers everything. So it's including the use of the adult day center, the transportation, any labs, any imaging, any hospitalizations, any consult visits, you know, whether they're going to see their cardiologist, they don't pay any copay. It also covers respite stays. So we have family members, for example, that have an emergency work trip, or something comes up and mom can't be left alone. And so PACE is there to really arrange, you know, either short-term placement for mom or in-home care, and that is all covered.
Oh, that's very valuable.
Yeah.
When is the right time for a family caregiver to consider looking into the PACE program to find out if it's the right thing for their loved one?
Our patients are, you know, require help with their activities of daily living. So if a caregiver feels or sees themselves that they're actually needing to help their loved one with things like meal preparation, dressing, feeding, toileting, really that is a great time to call PACE. We're there both for the patients themselves and for their caregivers. Usually they're informal caregivers, right? Mom had a stroke or developed dementia or has, you know, heart failure and diabetes and high blood pressure and requires going to the doctor's office, multiple doctor's offices, and runs to the pharmacy and to get the medication every month, and you know, sometimes needs to go into the hospital. And that coordination of care is really a big highlight of what PACE does, because we're able to do all of that and make sure we're following our patients and make sure that, you know, people don't fall through the cracks with regards to when they're transitioning care. So for example, if you know, my mom goes to the emergency room and maybe I'm not with her, she's not able to give her correct medical history because she's very sick.
Right.
And when you're sick and you go to the hospital and they're giving you medicines like morphine and that makes you more confused, you know, you really need someone there to be your advocate.
Right.
And that's what we do. You know, we're always calling the emergency room doctors and going to the hospital to see our patients to make sure that they have the correct history and the correct medication list and a good plan once they leave the hospital.
Right.
So.
This is wonderful information and very, very helpful. How can people find out more about your program?
The best way is to contact one of our enrollment specialists, and they do a tremendous job in helping navigate through the very complex, you know, healthcare system that we have.
Yes.
They can call our number. It's 703-239-5888. I think that number will be
it'll appear on the screen.
Later. Yeah. So, and then they'll ask for one of our enrollment specialists, and they'll be very happy to help them through all the paperwork and applications and talk to them about their insurance options and their healthcare options, because there are certainly, you know, if PACE may not be the right option for them, there are alternatives, thankfully, in the area that may be a better option.
Dr. El-Menshawi, thank you so much for joining us today and sharing all of this helpful information.
My pleasure.
I wish you all the best.
Thank you.
And thank you, our viewing audience, for watching this edition of Mature Living. I'm Ann Hall. We'll see you next time.